Welcome technicians. Today we look into our CB NAAT instrument. So that is our M10 from SD Biosensor. Okay, so CB NAAT basically stands for cartridge based nucleic acid amplification test. A similar instrument that is present in most of the other laboratories is what is called the CFAT's Gene Expert platform. Okay, so that is also a CB NAAT platform, and this is also a CB NAAT platform. Okay, so this is the instrument. This is the CPU that with monitor which controls the analyzer. Okay, this is the analyzer. Okay, this is a RT-PCR based amplification test, but only thing is here extraction and everything is inbuilt, so we call it as a CB NAAT, cartridge based nucleic acid amplification test. Okay, so this is the switch on the right side, on the left side of the CPU, so you have to click on, and this another switch on the back side of the analyzer, so both you have to switch on together. Once you switch it on, immediately the monitor will switch on and the analyzer also switches on. Ask for a username password. Once you give the username password, so this is how it is. So initially it will tell both are not connected to each other. Subsequently it will take hardly some 10-15 seconds, and then both will be connected. This is how the instrument will be switching on. Very easy. Whenever you want you can switch on, whenever you want you can switch it off. Very easy to switch on, switch off and all. So we look into how to process the sample before giving it to the instrument. There is a little work that you need to be done before. Okay, now any sample, CSF, pleural fluid, pericardial fluid, ascitic fluid, tissue sample, all these things can be processed in this instrument. Usually whenever tissue sample is there, usually I only handle it because it will be little difficult for the technicians to actually handle. But remember that if it is a CSF sample, minimum 500 microliter of the sample is necessary to do the test. Whereas for other samples and all, 600 to 1 ml also you can take. If any fluids are there, always make sure that you centrifuge it and take the sediment. Okay, don't run it right away. Okay, if it is a sputum sample, try to take the sample which looks good. Okay, we may have to pick up the sample. Okay, but in that cases you have to make sure that the end solution is as liquefied as possible, because sometimes what happens, the sputum is very mucoid, so during that time we may have to add more than 1 ml of the pre-treatment solution, but at any time not more than 1.5 ml of the pre-treatment solution to be added. Okay, that is the very important thing that you have to remember. Okay, so you can add only 1.5 ml of the pre-treatment solution and not more than that. Okay, so try to be below that only. Only for sputum samples only you require a little more extra. For others 1 ml will be sufficient. Okay, now once you add that, make sure that you are vortexing it, mixing it as much as possible. Okay, now one important thing is always select a sterile urine container, put the barcode, add the sample first. Once you add the sample, after that, this is the pre-treatment solution that is available with each cartridge. Take 1 ml of the solution, add it here, mix it well, and then vortex it well. Okay, that is very important. Always vortex it well for at least 3-4 minutes. Make sure that the pre-treatment solution and the sample is well mixed, and as much as possible some amount of fluidity is created. Okay, after that keep it in 37 degrees centigrade for 15 minutes. Okay, this is fixed. You can keep it for say 17-18 minutes also. Sometimes we keep it for 20 minutes also when a mucoid solution is there. But remember that the solution should not be used after 40th minute. Okay, if by mistakenly you have not kept the timer and you have mistaked it, then you have to redo the whole procedure. So don't continue. Okay, maximum you will keep it for 20 minutes. A minimum of 15 minutes is required. So once that is done, so after that be ready with this. This is the solution that you have taken it from the incubator. So it has got a syringe which is attached. Syringe has got a filter attached to it, and then the pipette, pasture pipette, and there is a bullet cup. So this is used for sonication. Okay, so first and the foremost thing, take this bullet cup and keep it in the rack, and add the incubated solution directly to this. Okay, around 1.5 ml, whatever is the solution is there, you keep it and then close it properly. Then sonicate it. So you slowly open this. If you turn this knob to the left, to the right side, it will open. Once it open, keep it in one of these positions and then close it back and give a start. Okay, so once you give the start, whenever the instrument is ready, it will become green in color when you start. So it will start blinking for the next 1 minute 30 seconds, and once it is ready, it will be done. Okay, now you take out the cartridge. Always make sure that before, once you start working only, the cartridge is taken out. At least 15 to 20 minutes the cartridge is in the room temperature only. Okay, so make sure about that. Don't take the cartridge at this time, because it will be still in the refrigerator, so it will not work properly. So make sure that it is kept in the room temperature for at least 15 minutes. So this is the cartridge. Now this is how it looks like. Okay, so it has got a protection here. As you can see, this plastic item that is present, this is the protection to this. So when this is present, the cartridge can be tilted, wilted, all these things can be done, because the individual component that is present inside the cartridge, they will not get mixed, because they are all in a sealed position. Okay, so you need to make sure that you break these seals. Okay, so how to break this? First and the foremost thing, hold your left hand on the base. This ash colored base is there. In that position you hold it, and with the right hand you pull this out. Okay, make sure that this extension that is present here, it is never touched. It any part of the work, you should not touch this part. Okay, that is very important. Okay, now once you pull it out, see, this comes out very easily. So once you pull it out, so this is the space that is present, and this is how it looks, and then you need to press it hard. Okay, so as you can see, there is a line here, and this is the gap that was on which that plastic was sitting. Okay, now you compress it fully. Okay, in one single go. You need a little bit of work to actually compress it down. Compress it in one single go. Okay, so once you compress, as you can see, in this, the whole top is sitting on that particular line. Okay, so check all the 360 degrees and make sure that at every place this is properly pressed. Okay, now once it is pressed, the cartridge should not be tilted or moved very fast or anything of that sort, because now the individual components here, they are all open, and the fluid can shift from one area to another area. So to prevent that, make sure that you don't tilt the cartridge. Now once it is pressed properly, you should not tilt the cartridge at all. Okay, so now you already had this instrument, so you open the cartridge. So this is how the cartridge opens, and see, there are two holes here. The central hole is for the movement. Okay, never ever use that. So, and it is written properly that sample has to be kept put here. Okay, so keep everything ready. Now open the syringe. Always open the syringe before you actually insert it into the cartridge. Okay, if you once or twice I saw technicians who put the syringe here and then pull the piston out. Don't do that, because you may suck the reagent from the chamber into the syringe. Okay, so to prevent that, you always pull the piston out first and then put it here. Okay, not in the center, in the side one. So once you put, with using the Pasteur pipette from the sonicated sample, you put the sample over here. Once you put the sample, make sure that you put the piston and you press it down, because many of the times what happens in the filter, some amount of fluid gets corrected or struck. So to prevent that, you just pull it. Okay, once you pull it, then close it. Okay, so remember, you should not tilt it, you should not move it very fast and all. So handle it very carefully now. Okay, it should not fall or anything like that. Okay, so now you come back to the instrument. So you already have switched on the instrument is ready. So in this white space, you touch anywhere, so immediately it will ask for the patient ID. Give the request number of the patient, that is 2600 number. Okay, so this 2600 number, it is a barcode is available, but most of the times our barcode is not read by this instrument. So because of that, manually you have to give. So patient ID is nothing but the UHID number. So UHID number of the patient and the name of the patient, both we give it as a patient ID. Then sample ID, we give the request number, that is the 2600 number. It should come here, sorry. So sample ID should come in 2600 number, that is in the sample ID, whereas patient ID is the UHID number and the name of the patient. Now once that is done, so as you can see, so this is the patient ID and this is the sample ID, and once it is done, the barcode will switch on, and then the assay name. So which cartridge you are using, so this barcode, QR code that is present, that has to be read below the instrument. So there is a barcode that will be able to read it. Now when you are giving the patient ID only from the instrument, this door would have opened already. Okay, so it will always open. Okay, be careful not to keep this cartridge in this part, okay, because when the door opens it may hit the cartridge and cartridge may fall. As I told you, once the seals are broken, the cartridge should not be tilted or anything like that. Okay, so once that is ready, you have to put the cartridge here like this. Okay, so the extension that was there, that has to go inside first, and this is how it is kept. The video is available. Once you this thing, this video will show how exactly you should insert the cartridge. Now once you insert the cartridge, put it and then close the door. Once you close the door, it will ask to confirm the patient ID, sample ID, and all these things and all. Now the new this thing, there is be a red color one disclaimer also present, which tells that be careful that everything properly you enter like that, and then you give OK. So previously we were giving only the UHID number of the patient. Then we learned that many the same patients, multiple samples and also may come. So now we are using this number also and patient name also. Okay, so both we are giving. This is the patient ID and you give OK. So once you give OK, so it will for MDR TB it will take 86 minutes, whereas for others it will take around 77 minutes depending upon which cartridge and which purpose you are using. Okay, so stay for 30-40 seconds, because if any error is there in the piston movement and all, it will come now only. Most till today we have not come across, but be cautious of that. Okay, so once that is done, it's over. Okay, so this is how you give the sample. Okay, so how after that we have to go ahead, we will see as we go along. Thank you.